My name is Seung Hee Choi. I'm assistant professor of nursing at Wayne State University. I'm a behavior scientist focused on health behaviors, especially smoking cessation among underserved, understudied population. And one group that I have been focusing on is smoking couples, where at least one partner smokes. For 6 years, I was cardiopulmonary ICU nurse. And at the time, I took care of patients who had open heart surgery or severe coronary artery disease. And for these patients, quitting smoking is absolutely needed for their survival. However, even after the near-death experience like major heart surgery, many patients were struggling, and they came to me and said they understood they need to quit smoking. However, they just couldn't. And that's because the physical addiction and psychological addictions are just too strong for them to overcome alone. I wanted to do more than just giving them the post-operative nursing care, but I want to guide them through the quitting journey. And I wanted to be with them. So that frustration drove me to the behavior science. And for these patients and these population and millions of other smokers like them, I wanted to develop the most effective smoking cessation intervention and make it available to them and improve their health and their quality of life. Smoking couples have unique challenges to quit smoking. For example, I once met a woman who had been smoking over 20 years, as well as her husband. So after she developed COPD, she knew that she needed to quit smoking. However, she really enjoyed the smoking break. Every evening when she talked about, with her husband, she talked about their daily life, kids issue, family issue, work life. So even though she understood she needed to quit smoking, but she really didn't want to give up the connection with her husband. And my research addressed the couple dynamics related to smoking among this population. And couple-based smoking cessation intervention really needs to account for these unique challenges that every smoking couple face when they try to quit smoking. And if we don't address these unique challenges and don't include both partners as a treatment unit, it becomes significantly challenging for them to successfully quit smoking. So my research, as a researcher, my ultimate goal is to make effective couple-based smoking cessation intervention and make it available to them and their family to use and help them to successfully quit smoking. One of the effective couple-based intervention is called the FEMCON, Family Consultation Intervention. It doubled long-term quit rate compared to other similar interventions. However, one of the weaknesses of FEMCON intervention is it never gets disseminated broadly. It never reaches the public because it is simply just too resource intensive. So in order to address these dissemination barriers, our team directly collaborated with one of the FEMCON co-founder and developed a web app called WeQuit for smoking cessation for smoking couples. We recently just finished our pilot test with 44 smoking couples, and the results are very promising. So moving forward, my goal as a researcher is to scale up the WeQuit app nationally through partnering with public health infrastructure, such as state-sponsored 1-800-QUIT-NOW telephone line and federally sponsored smokefree.gov. As a researcher, I strongly believe that one day when I develop the most effective smoking cessation intervention and make it available to all smokers and their family members, I can save millions of smokers' lives and improve their health and their family's health and their quality of life.